Now, dentists in Sussex say they're having to give up NHS work and go private in order to stay in business, making it harder and harder for families to find an NHS practice willing to take them on. 25 NHS contracts have been handed back across Sussex since 2020. Sussex Health Watch say 40% of people they surveyed last year were unable to find an NHS dentist, and 20% had resorted to paying for private treatment. But it means people who can't afford private fees are left in pain and unable to access the treatment they need. Our political reporter Lucinda Adam has the details.
We don't exactly look forward to visiting the dentist, but now finding one offering treatment on the NHS can be painful.
I just not with the dentist anymore because I haven't been able to find another one close by that's NHS.
So when was the last time you went to the dentist?
So the last time, so about 3 years now.
I've got one last free dentist appointment and I've got to start paying. I think that if we're paying that much tax and that, we should get free dentist. We get free healthcare, so why don't we get free teeth?
Here in Haywards Heath, S3 Dental was one of those who stopped seeing NHS patients last year. They say it had become impossible to sustain their business.
I think this is a problem that's been brewing for the last 20 years since the government enforced a new contract on dentists in 2006. It's been underfunded since, and it's a terrible contract. And so over the years, dentists have tried to make it work, but unfortunately, post-pandemic, it's just no longer feasible. The cost of living crisis has really hit home for a lot of businesses. For us, when we had to make that decision to stay viable as a business, it's sad. It was so sad because some of these patients have been with us since they're children. I've seen them, them grow up. And to be able to say to them, sorry, we can't see you on the NHS, it's just heartbreaking for a lot of us clinicians.
At a meeting today, West Sussex councillors said the situation was unacceptable. NHS Sussex says it has procured one new NHS contract, but only one, and says it's working on more plans to incentivise dentists to return to the NHS. But they say that flexibility is limited by the government contract. In a statement, the Department of Health said that while some reform had happened, there was more to be done, and it's working with NHS England on more improvements.
What happens to NHS dentistry may set a precedent to what happens next, to the next service and the next service and the next service. And then the equality of opportunity that we enjoy through making sure that our population can access healthcare will be hampered.
While the politicians grind their teeth, clinicians say the knock-on effect of poor oral health could put even more pressure on other NHS services. Lucinda Adam, BBC South East Today.